What psychological treatments are used for OCD? With effective treatment, people can learn to manage their symptoms and restore normal functioning. Best practice guidelines for OCD recommend cognitive behavioral therapy, CBT, and antidepressant medications for OCD treatment. While many people will benefit from using one or the other, those with moderate to severe forms of OCD often do best when both treatments are combined. It is important that people get treatment specific to OCD from a qualified CBT therapist. This type of treatment may be available in either individual or group formats, and each format has advantages and disadvantages. While some forms of traditional psychotherapy may help other aspects of a person's life, such as relationships, they are not effective for OCD. In addition to CBT, people with OCD may benefit from supportive counseling and marital or family counseling. Psychological treatment, CBT cognitive behavior therapy, CBT, is widely considered the best psychological treatment available for OCD. Specifically, a form of CBT called exposure and response prevention (ERP) is the most commonly used therapy in major healthcare settings. This treatment is based on some known facts about anxiety. Anxiety is a response to threat or danger. For example, people with OCD interpret certain situations as dangerous and therefore anxiety gets triggered. When something is perceived as dangerous, the fight, flight, or freeze response kicks into gear. How does exposure and response prevention (ERP) work? In ERP practice, a person will expose themselves to a situation that triggers anxiety, and then prevent the usual OCD response, compulsion or avoidance. ERP is based on the idea that problematic anxiety is often a learned process, and can therefore be unlearned. In ERP, people confront feared situations in a controlled and gradual fashion with the help of a therapist. The first step is to make a list of feared situations. The items on the list are organized in a hierarchy, from least anxiety-provoking to most anxiety-provoking. For example, someone with doubting obsessions might have a list that looks like this: 1. Leaving the house without checking the door, 40% anxiety. 2. Leaving work without checking office door, 70% anxiety. 3. Leaving house without touching knobs on stove, 90% anxiety. The next step in ERP is to confront the triggering situations listed in the hierarchy, one at a time, from easiest to hardest. The first exposure session, involving the easiest situation, is usually done with therapist assistance. These sessions can last between 45 minutes to 3 hours. The person will then be asked to repeat the ERP frequently in order to reinforce the new learning, that nothing bad will happen. When the behavior gets repeated enough times, a process called habituation occurs. Habituation means it gets easier over time. As the person becomes less anxious in response to the easier situations, their confidence slowly begins to grow. More difficult situations from the list are introduced, following the same process, until the person achieves significant relief from their symptoms. When a person only seems to have obsessions, without obvious compulsions, ERPs are tailored to obsessive thoughts. For example, a person with religious obsessions may expose themselves to their feared thought by writing it down on paper over and over again. Sometimes, direct, or in vivo, exposure is not possible in the therapist's office. For example, for a person with fears of yelling out obscenities in church, the therapist might ask them to use imaginal exposure. This is when a person imagines the different situations that provoke anxiety. Self-directed ERP. For people with mild OCD, ERP can be done successfully without the help of a therapist. There are some very useful self-help books to guide this process. Please see a list of recommended self-help books for OCD and related disorders in the description box. Is ERP effective? Research shows that ERP can help a person reduce their OCD symptoms by up to 80%, and maintain this improvement over time. A person's success with ERP therapy depends on several factors, including motivation. Other factors include symptom type and whether other disorders are also present, like depression. Studies indicate that over 75% of patients experience some kind of improvement with ERP treatment. Cognitive strategies. In addition to ERP practice, CBT also involves challenging the unhelpful interpretations in OCD, see cognitive theory, and promoting more realistic thinking styles. Using cognitive techniques, people can learn to identify problematic thinking patterns that contribute to OCD. When cognitive strategies are used along with ERP, patients will usually start by paying attention to thoughts and feelings related to exposure situations. These thoughts are then explored to find out what making the situation so upsetting. For example, some people with OCD have a tendency to overestimate danger, such as a belief that the likelihood of getting hepatitis C is very high by touching public doorknobs. Using cognitive therapy techniques help generate more realistic and helpful interpretations. There are several cognitive techniques used for OCD. A therapist or self-help book can help determine which are the best fit for specific obsessions. The thought record is a key tool used in OCD. Treatment model for OCD. In CBT, we break this vicious cycle by challenging those negative interpretations and eliminating the compulsions or avoidance. The diagram below illustrates the cycle of OCD from a CBT perspective. Thought record. The thought record is a strategy used to challenge unhelpful, distorted thinking patterns. The goal of the thought record is to increase awareness of what we are thinking and then to examine the validity of our thoughts. Steps include rating moods, identifying thoughts that may relate to the negative or anxious feelings, and looking at evidence that does or does not support the thoughts. Using thought records can help reduce anxiety by challenging the beliefs involved in OCD. There are many other cognitive techniques that can be used in treating OCD. These include responsibility pie, continuum technique, probability estimation, double standard technique, and can be read about in some of the self-help books listed at the end of this guide. How effective are cognitive strategies? Studies show that using cognitive techniques alone, without ERP, can help reduce OCD symptoms. However, experts generally agree that using both cognitive and ERP strategies are most effective. When used together, cognitive and behavior therapy tools work by learning new ways of thinking and behaving. You can contact us if you need professional mental health treatment from experienced psychologists and psychiatrists. You can check our description to get the full address. Thanks for watching. Please subscribe to get more important videos and comment to ask any questions related to mental health issues.